What happens when your health plan puts a limit on treatment? Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. Today, I'm talking with Shawn Stack, a policy director at the Healthcare Financial Management Association, about a listener question about those limits. A listener wrote in saying they have X number of treatments for physical therapy. That was the thing that they were dealing with. And once those are up, it's going to cost Y dollars to go for more. Is that something that's common in insurance? And, beyond physical therapy, what other kinds of things might be affected by this type of plan?
Yeah, Erica, physical therapy is one of the more common services that employers or insurance plan design limits for consumers. Many insurances and some Medicaid, Medicare Advantage plans cap physical therapy visits, usually to around 20 visits per year. Other services, Erica, that could often be limited based on plan design with insurance are things like occupational therapy, speech therapy, chiropractic services, behavioral health therapy. A little bit less common now, but some plans still cap sessions or require reauthorization for behavioral health therapy. And also durable medical equipment, caps on quantity per year, depending on the equipment that the consumer is asking for. So these limits are usually written into the summary of benefits of coverage or the full plan document where for the insurance benefits booklet that the consumer gets. But yeah, those are great questions, and those are some of the areas that are typically limited, that consumers could see limited.
So if you are looking at some course of treatment, like we're talking about, what kinds of questions should you be asking before you even start?
How many visits per year are covered for a specific medical procedure, item, or service? That's something that you can ask either of them. You can ask that with your provider, or you can ask that with your insurer. Does your deductible or copay apply to each visit? And that'll give you an idea of how much out-of-pocket cost you'll have. What happens if I need more visits than the plan covers? And can my provider request an exception if the service or the item is medically necessary? And of course, Erica, typical questions like, is there a prior authorization required before I start the treatment? And are there in-network versus out-of-network differences in those limits for that specific service? So those are all some helpful questions that you can ask your provider that you're scheduling with or your insurance to give you an idea of out-of-pocket cost and what those limits are.
So let's say I've reached my limit, whether I got an extension or not. I've now reached the limit, but I still need more, and it's going to cost me however much it's going to cost me. Are there resources available for me? Is there anything a patient can do besides deciding to pay it out of pocket or just not do it?
Yeah, there really is, Erica. You can request a medical necessity exception. You can have your doctor submit documentation asking the insurance company to approve additional visits based on your specific medical needs. And those can get approved based on your comorbidities and your medical needs for that specific service, whatever it is. You can also appeal a denial. If an insurer denies the provider schedule that service for you, you can appeal that denial if additional visits are denied, and patients can appeal those through their plan's grievance appeal processes. You can also ask about alternative coverage. Sometimes additional visits can be authorized under a very specific diagnosis code, and pointing that out to the insurer that you have that issue can many times get that service approved. For your earlier example, physical therapy, that might be approved through rehabilitation under your plan's design or habilitation under your plan's design. And then lastly, and certainly not least, Erica, if the insurance refuses to cover it after all those items are done, you may be able to negotiate a lower cash rate with that provider, making that out-of-pocket cost affordable to continue that therapy.
That's it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.